All right, today we're cracking open a real detective's toolkit. But we're not chasing criminals, we're tracking one of the most complex public health challenges ever, HIV/AIDS.
I mean, really think about this for a second. How do you count something you can't easily see? How do you track a virus that can just hide silently inside someone's body for years? And on top of that, how do you measure an epidemic that's so wrapped up in stigma, affecting communities that are often pushed to the margins?
Yeah, for decades, this has been the central challenge. You see, tracking HIV isn't straightforward at all. It's not like the flu, right? The flu kind of announces its arrival with a cough, a fever, you know it's there. HIV, it's a whole different beast. The usual simple counting methods, they just don't cut it.
So, to really get a handle on this thing and actually fight it, epidemiologists had to become something else. They had to become investigators. They needed a special kind of detective work. Okay, let's dive into exactly what that looks like.
So first up, what makes this such a special kind of problem? I mean, why is it so different? Let's break down the unique challenges that turn tracking HIV into a puzzle unlike, well, pretty much anything else.
When you look at this list, you realize pretty quickly it's not just one thing. It's a whole web of challenges all tangled together. For starters, you're not even dealing with a single epidemic. It's more like multiple epidemics all happening at once, hitting different groups of people in totally different ways. Then you've got this incredibly long asymptomatic period. We're talking years, which acts like a silent reservoir for the virus. And layered on top of all that is this severe personal and social stigma, which pushes people into the shadows, you know? It makes them invisible to the very systems that are supposed to help them.
And this timeline, wow, it just perfectly illustrates the biggest hurdle of all. Just look at that huge asymptomatic period right in the middle. It can stretch on for years. A person can be infected, and they can be infectious, all without even knowing it. Think about what that means. It means epidemiologists can't just go around counting people who are obviously sick. Nope. They need totally different methods for each stage of this thing, from trying to track risky behaviors before someone is even infected, all the way to monitoring AIDS cases years and years down the line.
Okay, so you're the detective, right? You arrive on the scene and it's this incredibly complex picture. Where do you even begin? Well, the very first step is to size up the situation. You got to figure out what kind of epidemic you're actually dealing with.
Because here's the thing. Every epidemic is different. You absolutely cannot use a one-size-fits-all approach. A strategy that works great in, say, one country might be a complete disaster somewhere else. So the first move, the very first play in the book, is to classify the epidemic.
And this is how they do it. It's actually pretty clever. They use a simple but really powerful indicator, the percentage of pregnant women at antenatal clinics who have HIV. Now, why them? Because that group gives a pretty reliable snapshot of what's happening in the general population. And based on that number, they can classify the epidemic. Is it low level, where you really need to focus on specific risky behaviors? Is it concentrated, where it's mainly in certain high-risk groups? Or is it generalized, spreading through the whole population, which means you need a massive, broad response? The single diagnosis right at the start shapes the entire investigation that follows.
Now, as you can imagine, the methods for this kind of detective work haven't just stood still. Oh no. Over the decades, the toolkit has evolved and gotten way more sophisticated.
If you think about it, the early methods back in the 90s were kind of like sledgehammers. Yeah, they were simple, and they were good for raising awareness, but they were blunt instruments. They missed a lot, especially the really crucial data on why and how people were getting infected, the risk behaviors. The second-generation approach that we use today, it's more like a scalpel. It's precise. It builds on the lessons learned, but it's all about tailoring the strategy to the specific type of epidemic you're facing.
And the key word here, the big idea, is integration. This second-generation surveillance is all about funneling multiple streams of data together into one place. So you're combining the hard biological data, from HIV and STI tests, with behavioral surveillance. That's the part that tracks the why and the how the virus is spreading. So it's not just about counting cases anymore. It's about building this rich, detailed, and most importantly, actionable picture of the entire epidemic.
All right, so this brings us to the real, on-the-ground detective work. I mean, how on earth do you gather data from groups that are, for all intents and purposes, hidden from view? Whether it's by choice or by circumstance, they're just not easy to find. To be effective at all, surveillance absolutely has to reach these key populations. But think about it. Because these groups are so often marginalized, sometimes even criminalized, your standard clipboard and append survey is completely useless. It's just not going to work. And this is where the detective work gets really clever.
Okay, so the first tool in the kit is something called time-location sampling, or TLS.
It's a method based entirely on probability. So, here's how it works. First, the researchers do the legwork, and I mean a lot of legwork. They map out all the different places and times a specific group of people might hang out. We're talking bars, parks, certain street corners, you name it. Then, they basically throw all those venue time slots into a hat and randomly pick one out. They visit that spot at that exact time and systematically recruit people. And that randomness, that's the secret sauce. It's what helps them get a sample that's actually representative of the whole hidden population, not just the easy-to-find folks.
But the second tool, honestly, this one is even more ingenious. It's called respondent-driven sampling, or RDS. Now, this method doesn't even bother with trying to find people in physical locations. Instead, it taps into something that every single person has, a social network. And here's the magic of how it works. Researchers start with just a few initial participants. They call them seeds. Then, those seeds go out and recruit a few of their own peers. And then that first wave of people recruits a second wave, and so on. It's like a chain reaction that grows and grows. What's so brilliant about this is that it uses the trust and the connections that already exist inside a community to reach people who would never, ever talk to an outsider holding a clipboard. In essence, the community itself leads the researchers to a sample that's truly representative.
And look, this isn't just some clever party trick, it's real science. As experts Johnston and Sabin put it, when you do it right, RDS yields data representative of the population. The key is in the analysis. You adjust the data based on the size of each person's social network. When you do that, you're literally turning this organic social web into a powerful, rigorous scientific tool.
Okay, so our detectives have been busy. They've used all these sophisticated methods to gather a ton of clues. But what's the point, right? I mean, data just sitting in a file cabinet is totally useless. The final, and arguably the most critical step, is putting all that data into action.
Because the whole point, the entire reason for all this painstaking work, the classification, the surveys, the clever sampling, is to make sure public health action is smart and targeted. This data is what tells officials where to focus their prevention efforts, how to spend their limited resources, and, this is the big one, it tells them if what they're doing is actually working.
And to make sense of it all, they use some pretty powerful software. You can see some of the names here. These tools are like crystal balls, but based on data. They take all that raw surveillance information we've been talking about, and they transform it into something incredibly valuable: predictions. They help forecast where the epidemic is heading, which allows policymakers to get ahead of the curve, to be proactive, not just reactive.
So these tools, they turn all this data into really powerful predictions. And when you step back and look at it, this whole detective's toolkit that was developed to fight HIV, it's really one of the great public health achievements of our time. It's this amazing blend of biology, behavior, and social network theory. It literally turns invisibility into information and turns that information into action. But the real question remains, right? How can we use all this knowledge, all these hard-won lessons, to get ahead of the next epidemic?